We are live.
Okay. So, good evening, postgraduates, and my namaskar to all the mentors. Brain Teaser, in association with Ophthalmological Society of Nagpur, is happy to present a Pan India intercollegiate quiz, the Big Q. This is the signature.
आठ समंदर अपना अंबर
साला तो
खोज
जीतना
ले
ही
अब
नहीं।
तू अपने दम पर भूख मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर आठ समंदर अपना अंबर खोज ले अब तू अपने दम पर भूख मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर खोल दे पर खोल दे पर खोल दे पर खोल दे पर बंद घड़ी की भी रुकी हुई सुई होती सही दो दफा चुप क्यों है रहना मन का तू कहना रोके चाहे हिचकियां खोल दे पर खोल दे पर खोल दे पर
Yeah. So good evening, friends, and once more my pranam to all the mentors. Here, Brain Teaser team welcomes you to this second quarter final of the fourth season of Big Q. As you are all aware, this is an online platform, Brain Teaser, for hosting quizzes for ophthalmologists from our country since last 6 seasons. And it is since last 3 seasons. This is in fact the fourth season where we are having a exclusively dedicated quiz for postgraduates with the sole aim of getting all the postgraduates from across the country on a single platform. This season is being done in association with the Ophthalmological Society of Nagpur, and we are really happy this time we are having a participation of more than 380 plus teams. So in this fourth season today, my sincere most thanks on behalf of Brain Teaser team to President Dr. Krishna Bhojwani of Ophthalmological Society of Nagpur for associating with Big Q. The fourth season till date had 6 preliminary rounds. It intends to have 4 quarterfinals. Today is the second quarterfinal. Then we will have further 2 semifinals and 1 finals. These episodes are being aired on alternate Wednesdays at 7:30 p.m. as you are all aware. The team Brain Teaser is extremely thankful to all the quiz master who really toil hard to create a wonderful experience of learning with fun for you. Today's episode, we have quiz masters who have been, a few of them have been associated with us even in the last season. Let me welcome Dr. Arvind Maurya, who is currently an additional professor and head of the ophthalmology department at AIMS, Bibinagar, Hyderabad. Professor Anita Venugopal, who is professor and head at Cornea and Refractive Department at Arvind Eye Hospital, Tirunelveli, and Dr. Deepthi Joshi, who is a pediatric ophthalmologist at Joshi Eye Institute, Hubli. My sincere most thanks to all the 3 quiz masters for taking so much of efforts for our postgraduates. Such makeup projects are not possible without a strong financial backing, and indeed, we are indebted to His Highness team. My sincere most thanks to Mr. Suryanarayan and Mr. Naresh Rautela and Mr. Kautuv for their support and helping us to start this season as we have been doing in the past. I would also fail in my duties if I don't acknowledge the field force of His Highness, who made so much of efforts to enroll all the postgraduates from across the country. And of course, the smooth and flawless execution of Brain Teaser platform is being done by Numerotech. My sincere thanks to Sai and his team. So now, without much ado, let me hand over the further proceedings to my co-host, Dr. Shilpi Narnore, for familiarizing you with the rules of the game.
So good evening, friends. Welcome back to this second episode of this second quarter final. So these are our today's quiz masters. So let us quickly see what is the format. So in quarterfinals, 80 teams will be playing. So we have taken 20 teams per quarterfinal. Today is the second quarterfinal. So third quarterfinal will be on 7th of May. That is the Wednesday after 2 weeks at same time. So for Teams, you have to log in through both the devices, that is Kahoot and on the Zoom platform. First screen is a live quizzing, which will be on the Zoom platform. It will be only for the teams and will be face to face with the quiz masters. Second screen is the Kahoot for the MCQ round, and it can be played by both the audience and the teams. I request all the mentors to log in from the separate screen only on the Zoom platform. So out of 20 teams, 5 teams will qualify for the semi-finals, and the criteria for qualifying for semi-finals is the respective marks of your quarterfinals and the best 4 performances of the preliminary rounds. So we'll have 15 MCQs. So 5 sets of each set will have 5 MCQs. There is no negative marking in that round. The second round is the rapid fire round only for the teams. So you will have to answer 5 questions in 30 seconds time. And this, for every correct response, you will get plus 10. For every incorrect answer, it will be minus 5. So if you don't know the answer, just pass. And also, if you don't know the answer, just pass and move on to the second question so that you can at least attempt all the 5 questions in the 30 seconds time. Teams who are not playing today's quarterfinal, even if they are in the quarterfinal 1 or in quarterfinal 3 and 4, or you haven't qualified for the quarterfinals, you can play as an individual in private practitioner category. So these are the prizes for the postgraduates in the finals, while the audience prizes are per episode. So now let me introduce our first quiz master, Professor Arvind Maurya sir. He is the first Indian to win Ophthalmic Star Award at Amsterdam ESCRS 2021. He has won multiple AIOS International Hero Awards. He is the first person to receive AIOS Senior Academic Achiever Award 2021. He has won many Best Free Paper Awards at AIOC. IRSI Gold Medal, Best Innovation, Best Cornea Video and Free Papers Award at IFFA DOS and DOS Best Video Award. He is heading many projects based on AI on DR and glaucoma. He has presented more than 500 international and national presentations, and to his credit are the 100 international and national publications. He is the associate editor of various societies. He has been conferred many oration awards and video awards. So with this, I'll play his questions as he's unable to join today. So this is the brief introduction of him. So let's start with the MCQ set 1. All are true about the anterior ethmoidal nerve except your options are A, terminal branch of the nasociliary nerve, B, it passes through the anterior ethmoidal foramen, option C, nerve enters the nasal cavity and supplies the nasal mucous membranes in this region, and option D, the nerve continues to innervate the external skin below the lower lid. Your time starts now. Time is up. And the correct answer is the nerve continues to innervate the external skin below the lower lid. Now coming to the next question. True about the muscle of Rheolin is. It's an extension of the superficial tarsal muscle. It's condensation of the levator muscle sheath. Option C is it is the most superficial portion of the orbicularis oculi. And option D is it is a sheet of connective tissue. Your time starts now. Time is up. And the correct answer is, the true statement is, it is the most superficial portion of the orbicularis oculi. Moving on to the next question. Sattler's layer is. You have to identify the correct option. Option A is outer layer of the ciliary body. Option B is middle layer of small to medium vessels of choroid. Option C is it is a part of Brooks membrane. And option D is these are choriocapillaries. Your time starts now. Time is up. And let's see what is the answer. Sattler's layer is the middle layer of small to medium vessels in the choroid. Moving on to the next question. All of the options, they develop from the neural crest except options are option A, RPE, option B, ciliary muscle, option C, corneal endothelium, and option D, trabecular meshwork. You have to say which does not develop from the neural crest, and your time starts now. Time is up, and the answer is RPE. Moving on to the next question of this. This is the last question of this set. All are components of mucin layer except option A, MUC5AC, option B, membrane forming mucins, option C, immunoglobulins, and option D, electrolytes and solutes. And your time starts now. Time is up. And the correct answer is option C. So with this, I introduce our next quiz master for today, Dr. Anita Venugopal ma'am. She is HOD of Cornea and Refractive Department at Arvind Eye Hospital, Tirunelveli. She is presently doing research scholar in School of Public Health at University of Michigan. She has 13 years of experience in cataract surgeries, corneal transplants, and refractive procedures. She has more than 100 publications in the peer-reviewed journals. She has to her credit the 4 book chapters. She is editorial board member of IJO. She has won the IJO Silver Award Best Paper Appreciation Awards in 2022 and 24. She has national and international accolades for her clinical videos and the photos. And she is involved in key research projects, major projects like SCOOT2, Greenberg Project, genetic and imaging studies in Down syndrome and keratoconus. So with this, I hand over the screen to Dr. Anita ma'am.
Yeah, thank you, Shilpi. Thank you, Prashant sir, for including me in this session. It has been a great, real pleasure for me to engage with all of you through this platform. So this is rapid fire round. So good evening, everyone, and it's most exciting part of the quiz now. And please ensure your mic is unmuted and be clear in answering. And faster you respond, more points you gain. So shall we start, Shilpi?
Yes, ma'am. So the team 1 is team diopter.
Okay.
Please, your audio and video both should be on.
Yeah.
Yes,
So can you please introduce yourself?
yeah. Good evening, ma'am. I'm Dr. Shivam Agrawal from AIMS Raipur.
Ma'am, I'm Dr. Amal from AIMS Raipur.
You are from which year? You are which year
Ma'am,
resident?
first year.
First year.
First year residence. Great. Okay. So, ma'am, shall we go ahead?
Yeah.
So once again, you will get 30 seconds. Be
Yes.
closer to the mic so that you can be clearly audible. Okay.
Yes, ma'am.
And if you don't know the answer, just say pass. You can attempt if you get the time later on that question. Okay.
Okay. Yes, ma'am.
Are you ready now?
Yes, ma'am.
Let's test your reflexes.
Okay.
So,
The first question is, curly fibers in Bowman's layer are characteristic of
Pass.
dash.
Pass.
The Fourier domain OCT achieves higher axial resolution because it uses broader spectrum of light. True or false?
Pass.
So which law states that when one muscle contracts, its adductors must relax to enable coordinated movement?
Herring's law. shortest cycloplegic is tropicamide.
Okay, Shilpi, can we give this to for them?
Yes. Yes, ma'am.
So I heard you saying like third question also some
Yes,
the name of the law.
herrings.
Can you?
Herrings.
They said herrings actually. That
So
is the raw. Yeah.
yeah, the is that
Charrington.
curly fibers. It is Thiel Buckney, and the statement is true. Like Fourier domain is higher, has a higher resolution, and the law is Sherrington's law, and the shortest acting get 10 points. And father of automated perimetry is Frank Frohauser. Fanhauser.
So plus 5 for them, ma'am, from this round.
Okay.
Okay. All the best.
Thank you.
Thank you.
So the team 2 is Oculus Repairifo.
Yes, ma'am. Hello.
Introduce yourself.
Myself, Dr. Shaima, from Ananda Institute, Hafsigoda, Hyderabad. I'm an final year student, exam going.
And I am
Hello,
Dr.
Ram.
Hamipriya, final year DNB student from Ananda Institute.
So we'll only take one answer. Okay.
Yeah, ma'am.
Yeah. Okay. So, ma'am, shall we start?
Yeah, let's keep the energy high, guys. Okay, let's start. First question is layer of cornea that is affected by copper deposition in Wilson's disease.
Desmond.
Sebaceous carcinoma is the most common malignant tumor of the leaden Caucasians. Is it true?
True.
What is the name of the law that states the retinal image size remains unchanged when the correcting lens is placed at the anterior focal point? You want to
Pass.
pass?
Don't remember.
So the
Yes, ma'am.
the answer like they had given for first question. So plus 10.
Yes, ma'am. You can
Yeah.
attempt the 2 questions, but you will not get the marks.
Yes.
Normal
Uh,
arm.
What is a normal arm to
Normal arm to the
11 to 13 seconds.
retinal
Ma'am.
time in FFA.
12 seconds? And father of modern cataract surgery?
Okay.
So Jacques Daviel.
Pass.
So French for ophthalmologist. So he's just started like a new method of curing cataract by removing the lens. That was in an academy, in a French Royal Academy, he had just posted that. So he's been called as a father of modern surgery since then. And then sebaceous gland carcinoma, that is false because the basal cell carcinoma is more common in Caucasians and sebaceous gland is more common in Asians. Okay. And the law is Knapp's
Okay.
law. Rest of that we discussed. Okay.
Thank you.
10 points, is it, Shilpi?
Plus 5. They answered one incorrect.
One correct. Okay.
So the team 3 is estimates, but they requested that they will play at the end because one of them is traveling at present.
We're there, ma'am. Ma'am.
Okay, so you want to play?
He's just came back, ma'am.
Yes, ma'am. Yes, ma'am.
Okay, okay. So introduce yourself, please.
I'm Dr. Krutin Shah from Arvind Eye Hospital, Coimbatore, second year.
I am Dr. Abhishek, second year, Arvind Eye Hospital.
Guys.
Shall we proceed?
Yeah, sure.
Okay.
The first question is branch vein occlusion study.
Injection. Branch retinal vein occlusion.
What is the modality of treatment they have studied? So pass. So pass.
Brooks membrane has 5 to 8 layers.
So modality of treatment, I'm asking.
Laser.
Time. You have wasted time. Like you should not do this. If you're not like confident, then you have to pass so that you can answer the other questions.
So they have given 2, Mama, they have said 5 to 8. What you will say for this 4th one?
So how many layers does
This is 5 only.
5.
There is no range in Brooks membrane layers, basically. So,
So what is their marks now? So
you want us to give them half marks for this?
so laser, they said at least.
Yes, that is, yeah.
Um,
So, okay, we'll give them the half marks for this.
yes. Yes.
Okay, so plus 15. Okay. Yeah. Team 4, Irrational Iris. They haven't joined, ma'am. So we move on to the next team, that is Team Bifocals. Please introduce yourself.
Hello, ma'am. I'm Dr. Sanmita Handal from second year. I'm Swati from second year. We are from MRMC Gulbarga, Karnataka.
Okay.
Welcome, doctors.
Be closer to the mic, please. Shall we start?
Yes, ma'am.
Okay.
Right. Okay. Which vitamin is known to cause reversible toxic viscoid maculopathy?
Pass.
Confocal microscopy eliminates out of focus of light for higher resolution compared to traditional wide microscopy. True or false? So during any conjugate movement, equal simultaneous innervation flows to the yolk muscle. Which law is it?
Hering's law.
What is the embryological origin of tabicula meshwork?
Neural.
So they have 3 right.
Yes, ma'am, they have given the answer for the fourth one also.
Neural crystal.
Yeah, okay. Then 4 right answers we can give them.
40.
Then
Okay.
father of retinal detachment surgery is Jules Gonin. So they have 4 right answers now.
Plus 40. Good.
Very good. Brilliant.
So the next team is Brave Believers. Ma'am, they haven't given the first answer, I think. Last
Oh,
team.
they said, oh yeah, they did not give. Yeah.
Yes. So it's plus 30.
They passed. Okay, they passed the
Yes,
quiz.
they passed. 30 plus 30. Yes, ma'am. Yes. So next team is team Brave Believers.
Yes, ma'am.
Good evening, ma'am.
Good evening.
My name is Dr. Divyanjali.
Myself, Dr. Rakesh Menon.
We are from GMC Bhopal.
Welcome.
So are you ready?
Yes, ma'am.
Yes. Okay. So your time starts now.
Who invented gate, a method of measuring IOP?
Past.
Pupillary reflexes are normal in the right ocular occipital cortex infarct. True or
False. False.
Unilateral central foveal suppression scotoma with absence of bifoveal fusion or absence of.
Past.
What is CNTGS?
Past.
Weekly regimen is followed for which anti-metabolite in uveitis?
Pass.
So
it's minus 5.
5, yeah, minus 5 this. So who invented gate? Gate is the Goldman applanation tonometer. So for measuring is Hans Goldman. And pupillary reflexes are normal in the right occipital cortex infarct. It is true. Unilateral central foveal suppression scotoma with absence of bifoveal fusion and presence of peripheral fusion is called microptia. And the TGS is collaborative normal tension glaucoma study. And weekly regimen is followed for which anti-metabolite is that? Methotrexate.
So with this, we are over with the 5 teams. Ma'am, can you please introduce Dr. Deepti?
Yes, yes. Uh, Dr. Deepti Joshi, she's a pediatric ophthalmologist at Joshi Eye Institute, Hubli. She's actively involved in PG teaching for past 8 years and recipient of Best Squint Paper Award at AOS and Best Squint Video at World Society of Pediatric Ophthalmology and Strabismus. She has multiple publications in national and international peer-reviewed journals. And beyond ophthalmology, she is also a book of world records for training maximum teachers at Stretch about safeguarding children against child sexual abuse. Over to you, Deepti.
Thank you, Shilpi. Thank you, Prashant sir, for giving me this wonderful opportunity. I think this is the third season I've been consecutively involved, and it's always a pleasure to be a part of BQ. So with this, I think we can begin with our series.
Yes. So the next team is Team 7 Champions.
Yes, ma'am. Good evening, ma'am. I am Dr. Samruddhi Jain.
I am Dr. Mohini Kukade, and we are second year residents from GMC Chhatrapati Sambhajinagar.
So Team 7, all the best. And
you,
here
ma'am.
comes your question. So the first question, a thickened arrangement of connective tissue between inferior oblique and inferior rectus muscle is known as?
Pass.
A 5-year-old girl has left eye esotropia and a limited adduction with narrowing of lid fissure.
Type 1.
So what type of
1. Type 1. Type 1.
Muscles of iris is derived from neuroectoderm, true or false?
False. No, true.
What is ampullaceous line?
Gonioscopy वर. Gonioscopy
nice.
वर इथे ती line.
Okay, what on gonioscopy? You can finish it off.
Sclerosis.
नहीं.
So with this, we wrap up your rapid fire round. So the first question is thickened connective tissue between inferior rectus and oblique is your suspensory ligament of Lockwood. And I am here talking about DRS type 2. Remember, B comes before D. So abduction restriction is type 1, adduction restriction is type 2, B and then D. So that was wrong. Muscle of iris derived from neuroectoderm, true. Okay, you said false and then you rectified yourself to true. So that is a right question. Ampullaceous line, that is an increased pigmentation anterior to Schwalbe's line, which can be seen in pseudoexfoliation and pigment dispersion. And the last question you have skipped, and that is Sushruta, who is known as the first known as cataract surgeon. So Dr. Shilpi, the second one was wrong and the third one is correct.
Yeah, so +5 to them.
Okay.
Thank you, ma'am.
Okay. So the next team PG, your phone number, it's from Kalaburagi, Karnataka, Gulbarga Institute of Medical Sciences. Are you there? Team 8. Okay. We move on to the next team, that is Team 9, Symbiotes.
Good evening, ma'am. Hello. Can you hear us?
Yes, Symbiotes.
Myself, Arun, ma'am. This is my friend Kalyan. We are from Jipma, Puducherry.
Okay, so friends, welcome to this rapid fire session. So don't waste too much of time. Just keep answering fast. So we begin with your rapid fire now. What is the volume of an adult eyeball?
6 ml.
What does E stand for in EDOF lenses?
Enhanced.
Orthokeratology can be used to correct myopia, true or false?
True.
Iron line in front of the head of pterygium.
Stocker's line.
Identify this famous Dutch ophthalmologist. Dutch. You have time.
Okay.
Whom did you look at, by the way? Okay, anybody, you can guess anyone by looking at that photo. किसी का भी नाम बोल दो.
इसका नाम बोलूं.
इसका नाम बोलूं. He's thinking now. छोड़ दो, मेरा ही नाम बोल देती हूँ. Okay, so the volume of extended, you were perfectly right. It's around 6 to 7 ml, so that's acceptable. E is extended.
Said expanded. So
what did you mention?
Enhanced depth.
Enhanced dimension. Yeah, that was a wrong answer. Orthokeratology can be used to correct myopia as well as it can be used to correct myopia progression. So your answer is right. And Stocker's line is correct, which is the iron line in front of head of pterygium. And that is your Hermann Snellen, the one who introduced Snellen's chart. Kiska naam bole Snellen bol deta to right ho jata. So you have 3 right
Plus
and 1 wrong.
25.
Good, great, good.
Thank you.
So the next team is Team 10, Elshnik Pearls. Team 10, have you joined? Now the next team is Team 11, KMCRI. Please
Hello.
introduce.
Hello. Hello.
Yes.
Myself, Dr. Shruti from KMCRI Hubli.
Myself, Mohammad, third year KMCR.
Okay, so Shruti and Madhu, we start with your rapid fire.
They are from Hubli.
Yeah, they're from
Yes.
Hubli. They're from KMC.
Games, yes. Shall we start?
Yes. So we start your session. The lens fibers meet at Y sutures in which part of nucleus of the crystalline lens? Which nucleus?
Embryonic.
Okay. Who described the 4-step approach for intermediate uveitis?
Pass.
Parietal bone forms the roof of the orbit. True or false?
False.
Name the lines radiating around the disc in setting of raised ICT.
Patterns line.
Patterns.
Patterns line.
Identify this German physicist.
Pass.
He gave us an important ophthalmic instrument. Okay, you passed it. So the Y embryonic nucleus is correct. So 4-step approach for intermediate uveitis is Kaplan. You didn't answer. Parietal bone forms the roof of the orbit is false. The patterns line, you have answered it correct. So that's the lines which radiating around the disc in the setting of raised ICT. And this German physicist is Hermann von Helmholtz, who gave us the ophthalmoscope. So
Plus
I think the
30.
two.
Plus 3. Plus 30. Second and fourth they pass. Rest 3
Yes.
were right. Yeah.
2 were correct.
3 were
Three,
correct.
three, ma'am.
3 were correct. Embryonic
Areha.
nucleus, false, and patterns.
Patterns line. Okay.
So the next team is
Thank you.
TMC
Thank you.
Team GMC. Team 12. Team 12. They joined.
They had joined that time.
Yes.
They are there. They're still there actually. Team 12 is there.
Team 12 GMC.
Can you introduce yourself?
Myself, Dr. Jelisa from Government Medical College, Kottayam, third year. Myself, Litti from GMC Kottayam, third year.
So all the best. Kottayam team, and here comes your rapid fire. Name the accessory lacrimal gland which is situated in conjunctival fornix. Intraocular penetration of topically instilled drug is determined by which corneal layer?
Corneal epithelium.
Axial myopia is in the cornea because of too strong refractive power. True or false?
False.
Name the whitish yellow perivascular retinal exudates in sarcoidosis.
Pass, madam.
Okay. So, no, we can't take the last question, but do you know who he is? Okay, their answer comes there. Okay, so the conjunctival fornix has the cross glands. There are 2 accessory lacrimal glands, cross and Wolfring. The cross is in the conjunctival fornix. Epithelium, you have actually answered it. So the topically instilled drugs, the penetration is determined by the epithelium. Axial myopia is caused by cornea having too strong a refractive power. That is false. You have passed it. Candle wax drippings, that is the perivascular retinal exudates in sarcoidosis. And the last one was the most easiest one, Harold Ridley. You could have actually reached that question faster. So with this, Shilpi, their score would be
Plus 20.
congratulations.
Yeah, ma'am. Okay.
Okay. So the next team is team 13, team DRP. Team 13, DRP.
They are not there.
Are not there. Team 14, eye poppers. Team 14. Team 15.
They are there.
Hello.
Yes, please introduce yourself.
Yeah, ma'am, I am Dr. Vishruti Trivedi, and she is ma'am Dr. Jinisha. And ma'am, we are in Nagri Eye Hospital from Gujarat, Ahmedabad. Ma'am.
So all the best, Team Gujarat, for your rapid fire, and your time starts now. Long ciliary nerve is a branch of
Trigeminal nerve.
Ring seen on the anterior lens capsule in pseudo-exfoliation syndrome.
Pass.
Palpebral oculogyric reflex can be normal, inverse, reverse, perverse. True or false?
True.
What is grayish-white discoloration of retina which happens in coupe and or counter coupe injury?
Pass.
Identify this American ophthalmologist. You can identify him. A very famous person.
No idea.
No idea. Okay, so the first question, it's not trigeminal nerve directly. You have to answer the nasociliary nerve, which again in turn is a branch of ophthalmic division of trigeminal nerve. So trigeminal nerve bahut dur hua. Even if you had answered ophthalmic, we could have taken it. And the ring seen on pseudo-exfoliation syndrome on the anterior lens capsule is hoarfrost. I was expecting you would say osseous, which is seen most commonly in your textbook, that is in blunt trauma. The oculogyric reflex can be normal, inverse, reverse, perverse, and that's true. Coupe and counter coupe injury, the most common whitish discoloration on the retina is Berlin's edema. And he is your father of phacoemulsification, Charles Kellman. So that was the reason I asked you to guess his name. So Dr. Shilpi, their
I think for the first one, we'll not give them marks, but we'll not deduct also.
Okay.
So plus 10 to them.
Thank you.
So with this, we end with the 10 teams rapid fire round, and it's time for the MCQ set 2. So just refresh your Kahoot platform buttons. So the question 1 in set 2 is, all are true about ABCA4 transporter protein except option A, major role in visual cycle. Option B, so mutation in its gene leads to Stargardt's disease. Option C, it leads to accumulation of lipofusion. Option D, it prevents the accumulation of pyridinium bis retinoid. And your time starts now. Time is up. And the correct answer is, it leads to the accumulation of lipofusion. This is a wrong answer. Wrong statement, I mean. So moving on to the next MCQ. All are true about cidofovir drug except your options are option A. Its maintenance dose is intravenous, that is a 5 milligram per kg every 2 weeks. It's a non-competitive inhibitor of DNA synthesis. It's effective against CMV retinitis, and it is nephrotoxic, which is dose related. Your time starts now. Time is up. and the correct answer is option B. This is a wrong statement. It is not a non-competitive inhibitor of DNA synthesis. Moving on to the third question. Alpha hemolytic streptococcus pneumoniae growth is best seen with option A, 5% sheep blood agar, option B, non-nutrient agar, option C, calcofluor staining, and option D is Muller-Hinton agar. Your time starts now. Time is up, and the correct answer is option A. Moving on to the next question, the characteristic feature of Best disease. Option A, abnormal EOG with increased Arden ratio, abnormal EOG with reduced Arden ratio, normal EOG with increased Arden ratio, and normal EOG with reduced Arden ratio. Your time starts now. Time is up, and the correct answer is option B. So it has abnormal EOG with reduced Arden ratio. So the last question of this set is, which is the best immunostaining for lipid antigens in sebaceous gland carcinoma? Options are option A, adipophilin, option B, glial fibrillary acid protein, option C is melon A, and option D is S100 immunostaining. Your time starts now. Time is up, and the correct answer is option A, adipophilin. So with this, we end with the MCQ round 2, and it is time for the commercial break. We thank the His Highness team for all the support. So now it's again time for the rapid fire round. I request Dr. Anita ma'am.
Yes,
I just want to confirm whether team 19, SRMS team 2, have they joined? Team
Yes, ma'am.
Okay. But just wanted to confirm that. Anita ma'am and Dr. Deepthi, actually only 5 teams are remaining. 5 teams they didn't join basically. So 3 you will take care. Then 2 I'll hide the questions, and next 2 teams Dr. Deepthi will. Okay, ma'am?
Anything is okay. If Dr. Anita wants to finish 5 also is okay. Anything is okay, however you say.
No, I'll just I'll hide these questions and then we'll play.
Okay, sure.
So I'm stop sharing the screen for 1 minute so that I can just hide these questions. Yes. So we are back with the next set of rapid fire rounds. So the next team is Team 16, Shifa I.
Hello.
Hello, please introduce yourself.
Yes, I have unmuted and
No, we can hear you, but you are not, I mean, clearly audible.
not
loud.
clear. Audible.
Please be closer to the mic.
Okay, yes. Hello.
Yes.
I am Dr. Muhammad Akhlaq from Patna Medical College. And
Myself, Dr. Namika from PMCH, ma'am, third year resident.
Okay. So, okay, any one of you will answer the questions. Okay.
I
Okay.
answer. I
Okay.
answer, ma'am.
Be closer to the mic.
Yeah, I will answer, ma'am.
Yeah, but you be closer to the mic.
Okay,
Okay.
okay, ma'am.
Yeah.
Yes.
So, ma'am, shall we proceed?
Good luck. Good luck, both of you. So, a method for visual field testing using ring-shaped tests to assess the extrafoveal
Pass.
resolution. Blue eyes have a greater corneal sensitivity to touch. Is true or false?
Pass. The
Ani-
fourth one is the fourth one is lactose fermenters, E. coli. And the fourth one and the third one is also pass. And fifth
Father
one is
of
also pass.
history.
Fifth one is also pass.
Okay.
So we can give for a fourth question. What type of bacteria cultured is gram-negative? They said E. coli, but we can give them. And then a method for visual field testing using a ring-shaped stimulus, dark borders and bright core is to assess the extrafoveal resolution is high pass resolution perimetry. Blue eyes, they have a greater corneal sensitivity to touch. That is true. Studies have shown that the lighter iris have a greater corneal sensitivity due to increased density of nerve fibers. And unequal pupils in lateral gaze is which phenomena? That is Tornay's phenomena. So this is a pseudo phenomena. There is an apparent chorea in the lateral gaze due to the partial lid coverage. And the father of ophthalmological history is Julius Hirschberg. Because he has meticulously he has documented the ophthalmology from antiquity to the 19th century. That's why he is called the father of ophthalmological history. Okay.
Thank you, ma'am.
Like one question.
Plus 10 to them.
Okay.
So the next team is team 17 cone heads.
Hello. Hello, ma'am. Are we audible?
Yes, yes. Please introduce yourself.
I'm Siobhan from Shankara Hospital, Coimbatore, second year. I'm Dr. Kamita, I'm second year from
Okay. Can you be closer to mic? Okay.
Okay. Yes. Can you hear us now?
Yes, it's better now.
Okay.
Okay. So shall we start?
Yes, ma'am.
Yes. Good luck.
Thank you.
So visual anisoagnosia is called as syndrome. Effect of IOP after regular physical exercise is because of increase in systemic blood pressure. Is it true or false?
True.
Direction of eye movement is independent of eye's position in the orbit. True or false? What is the law? Sorry. What is the law of the direction?
Next, pass.
What is the name given to the type of statistical hypothesis that proposes no statistical significance exists? What is that hypothesis called? I'll give it to you if you can answer the correct answer for this.
No,
Statistical hypothesis that no statistical significance.
something. Oh, I can't remember.
This is from your SPM.
Yeah.
Okay. Ma'am, what you answered for the first question?
I don't think so.
We
They
should
answered.
pass or what?
They passed.
Patterns. Can we pass?
What?
They passed. They passed, Shilpi.
Okay, ma'am. Okay.
Answer. Yeah.
So,
The correct answer is Anton Babinski syndrome. And the second question they actually answered true, but it is false. So the effect of IOP after regular exercise is reduction of IOP, like it is due to the increased outflow of the trabecular meshwork and change in the autonomic tone of the ciliary body muscle and the osmolarity and episcleral venous pressure changes and not directly due to the systemic blood pressure. Okay. And the Daundler's law is the direction of eye movement, which is independent of the, and that is null hypothesis. So, and the father of modern optics is Alhazen. So Shilpi, like they
-5 to them.
yeah,
ma'am.
yeah.
No issues. So the next team is Team 18, Pupil Petrol. Team 18. Team 18, are you there? They initially joined. Team 18, are you there? No, ma'am. So, ma'am, with this, we move on with the ma'am's round.
Madam, they have posted in the group that they are there, Pupil Patrol.
But we can't hear them, we can't see them. So what to do, Sai?
Just a moment.
So meanwhile, we can move ahead with the next team. So Dr. Deepti?
Yes.
So the next team is Team 19, SRMS Team 2.
Team 19, would you introduce yourself?
Ma'am.
Please introduce yourself.
Hello, this is Dr. Varun from SRMS JR2, and along with me is Dr. Anugia JR3. Currently, she is in emergency, so she can't be on the video.
Okay.
Okay. So, Dr. Arun, here is your rapid fire and your time starts now. Name the two bones forming the lateral orbital wall.
Zygomatic and frontal.
Post-cycloplegic refraction, child is having hallucination. What is the drug?
Atropine.
Optic nerve is formed by axons of cells in inner nuclear layer. True or false?
True.
Name the iron deposition line in filtering blood.
Kodas line.
Okay.
And
the last question was?
Diefenbach. Sir, Diefenbach.
Okay, so we go to the answers. They are formed by zygomatic bone and the greater wing of sphenoid, the lateral wall of orbit. And the drug is not atropine or cyclopentolate, but mostly it is cyclopentolate, but atropine can be taken. Optic nerve is formed by the axons of the ganglionic cell, not the inner nuclear layer. So that's a false answer. Ferris line is the iron line which is seen in front of the head of the filtering bleb. And the strabismologist is von Nuden, but that was beyond the time limit. So Dr. Shilpi, what would be their score?
They have answered 1 correct and 3 wrong. So it is -5.
Okay.
So next team is last team, the icons, Team 20.
Madam, Team
Yes.
8 is joined.
Okay, so we'll take them after them.
Sai?
Hello.
Team 20, can you introduce yourself?
I'm Dr. Alicia Gorwal. I'm Dr. Sukanya Priyam. We are from the I Foundation, Coimbatore.
So,
Shall we?
icons, your time starts now.
Name
Name
the
the
two
two axes or the lines which form angle kappa.
optical and visual. What is the
What
normal
is the normal aqueous production rate?
1.25 microliter per minute. The choroid
Choroid
is
is
the
thickest at the
thickest
posterior
and
pole.
posterior pole.
True or
False.
false?
Name
Name
the
the retinal
retinal.
hemorrhages with the pale center.
Pass. Name the
Who
Australian
is this Austrian ophthalmologist?
Pass.
Okay. So the angle kappa is formed between the pupillary and the visual axis.
This is wrong, na? They have answered
Yeah,
it
you
wrong.
said optical and visual. And the 1.25 microliters, no, it's 2 to 3 microliters. So it's not milli ml, it's microliters basically. And the choroid is thickest at the posterior pole is true. The retinal hemorrhages with the pale center is the rod spots. And he is Hans Goldman, who has invented the GAT, Goldman Applanation Tonometer.
What about the third question? Did they
I think
answer?
they passed it mostly. They were reading the questions and they were telling the answers also. Even so, they icons, they actually passed that question.
Yes. So it's minus 10 for them.
Okay.
Okay. So the last team have joined.
That would be by Dr. Anita.
Ma'am, if you can continue.
Okay. I think there are two teams who have put themselves on now.
Which two teams? Okay.
I don't know. There were Darren Jose who put themselves on and his sign is Surya Narayanan.
वो तो
Team Pupil Patrol.
Yes. Share screen. Yeah. So team 18.
Team 18, can you introduce yourself?
I'm Dr. Reshma from St. George Medical College, final year resident.
Darren Jose from St. John's Medical College, Bangalore, final year resident.
Okay. So all the best. We start with your rapid fire. Which structure divides lacrimal gland into two lobes?
Pass.
Pass.
What is the common laser principle of femtosecond laser and Nd:YAG laser? Both.
Photo disruption.
Photo disruption.
Peters anomaly is due to faulty migration of neural crest cells. True or false?
True.
True.
In limbal VKC, what is the white spots which is made of eosinophil and epithelial cells?
Collateral spot.
Identify this famous retina surgeon. So you still have the time. You can take up this question. He invented LASIK also.
Okay.
Okay. So the levator aponeurosis divides lacrimal gland into two parts. That is the palpebral and the orbital part. Photodisruption is correct. You get the right answer. And Peters anomaly is due to faulty migration of neural crest cells is true. Horner-Trantas spots is absolutely right. And that is the white spots in the limbal area, which is composed of eosinophil and epithelial cell aggregate. This is Gholam Payman. I think Payman book is most commonly read by most of us. And he is the retina surgeon who invented the LASIK. So Dr. Shilpi.
One team has joined. Can you please let me know which team is this? You have only written team. There is no team number, team name, nothing. Yes, you are. Please, you are from which team?
Team.
They have logged out. Okay. Any of the teams remaining for the rapid fire round?
Ma'am, team 8.
Team 8.
Yeah.
Okay. Okay. So, okay, I'll ask Anita ma'am to please take the questions.
Ma'am, our score is 30 right now.
Ma'am, we just want to confirm our score.
Yeah, I'll confirm.
The team 18 were waiting for their score actually.
Plus 30, plus 30.
Okay, thank you, ma'am.
Welcome, welcome. Yes, so team 13, sorry, team 8. Anita ma'am, you can, yes. So please introduce yourself.
Myself, Dr. Mamta, third year resident from GIMS Gulbarga.
I'm Dr. Shilpa, third year resident from GIMS Gulbarga.
Good luck.
Thank you.
Let's
Thank
start.
you. Yes, ma'am.
The binocular movements in same directions is called
Duction.
SWAP defects are more extensive than SAP because detects K cells comprising 5% of the ganglion cells.
Pass.
True or false? Sign where the fibrin is enhanced by heat may accumulate on the giant papillae is called. What was the sign called?
Pass.
Which extraocular muscle? Okay. Which extraocular
You can give
muscle?
this.
Yeah, we can give marks if you answer. Which is affected by canine tooth syndrome.
Inferior oblique.
So it is superior oblique.
Superior oblique.
But you
What
like,
option C?
so the binocular movements is
It is
worse. And SWAP defects are more extensive than SAP because it detects K cells that comprises only for 5% of the retinal ganglion cells. That is true because it is more sensitive and it detects very earlier changes. And sign where the fibrin that is enhanced by heat may accumulate on the giant papillae is called Maxwell line sign. This is superior oblique. And the father of subspecialty of neuro-ophthalmology is Frank Walsh. Okay.
So minus 10 to them. They answered 2 and both were the wrong answer.
Questions were wrong and okay.
2 questions were wrong.
Okay.
So with this, we end with the rapid fire round, and now it's time for the last set of MCQ. So the first question in set 3 is, telescopes as low vision aids for distant vision, all are true except option A, it's handheld spectacle mounted, they can be. Option B is the field of view is restricted. Option C is it works when distant objects are mobile. And option D is it has limited depth of focus. Your time starts now. Time is up. And the correct answer is option C. That is, it works when distant objects are mobile. This is a false statement. Moving on to the next question. All are true about Bellin Ambrosio enhanced ectasia display, except option A, elevation and pachymetry maps are placed side by side. Option B, delayed and ineffective screening of ectatic disease. Option C, raw elevation data lacks enough surface variability. And option D, reference shapes are BFS or BFTE. And your time starts now. Time is up. And the correct answer is option B. This is a wrong statement. Moving on to the third question. Which flags system is the best mobile version? Option A, Elcon Lensex. Option B, Zymer Z8. Option C, Zymer Z6. And option D, Zeiss Mel 90. Your time starts now. Time is up. And the correct answer is option B. Zymer Z8 is the best mobile version of the flags system. The second last question for today's quarterfinal is all are true about astigmatic vectors in the cataract surgery except option A, deviation of optical refractive surface from spherical curvature. Option B, it has both the magnitude and direction. Option C, CCI and SIA plays a major role. And option D, incision skew is of no importance. Your time starts now. Time is up. And the correct answer is option D. Moving on to the last question of today's quarterfinal. Which study was done for type 1 DM microvascular complications in the eye? Option A, UKPDS. Option B, ETDRS. Option C, DCCT. And option D, WEPDR. Your time starts now. Time is up. And the correct answer is option C, that is DCCT trial. So with this, we end with today's quiz.
So postgraduates, how was it? Was it really quite tough or what so? I hope not, because we had such a sweet quiz masters with us. They are so amenable and so friendly to each one of you, and I'm sure they must have not given you very hard questions to you. So now we are through with the second quarterfinals. And so it's time for us to now compute the results of today's quarterfinals. Until we are ready with the quarterfinal results, we will request all the quiz masters to just log in, as well as all the teams to log in. Let's have some chat with the quiz masters. Dr. Deepti, Dr. Anuradha, you can just log in, as well as all the teams. Please do log in for a while. So till the Sai and his team, numeratic team, is ready with the today's private practitioner category, the top 3 people who made it into it. Till then, we will be having some chat with all the team members. So let's move on with the team 1. That is, team 1 is Diopter from AIMS, Chhattisgarh. Yes, Dipti, you can join us. Dipti and Dr. Anuradha. Team Diopter, why don't you introduce yourself? Come on.
Good evening, sir. I'm Dr. Shivam Agrawal and this is Dr. Amal from AIMS
So,
Raipur.
Shivam and Aman, where are you from? You are from which place and who is your mentor?
Sir, I'm from Bhagalpur, Bihar. Sir, I'm from Kerala. And our mentor is Dr. Lubna Khan. She is a professor at TF.
Okay. Which subspecialty ma'am is from?
Ma'am is comprehensive ophthalmologist.
Comprehensive ophthalmologist. So Dr. Anita ma'am, they are from AIMS Raipur. They are doing absolutely well. Let us wish them all the best. And meanwhile, we also have the results ready for the private practitioner category. Just watch this. These are the numbers which have come 1, 2, 3, 906103136, 8368082207, 93150995559. So these people who are the toppers in today's category, request them to raise their hand, so that once they raise the hand, they would be admitted to this Zoom group, and then we can have a chat with them as well. Okay. So the team 2 is Oculus. Team Oculus, can you log in?
Yes, sir.
Where are you from? Why don't you introduce yourself once more?
Myself, Dr. Shaima. Hello.
Can't hear you well.
Hello. Hello.
Yeah, please go ahead.
Hello.
Yeah.
Yeah, hello. Myself, Dr. Shaima. I'm from Hyderabad, Ananda Institute, Hapsiguda. My teammate is not available right now. Now our mentor is we are final year students, exam going, and our mentor is Dr. Ramya. She's cornea. She will be completing her cornea fellowship.
So who is your director of Ananda Institute?
Dr. Satish
So
Agrahar.
tell Satish, he would be a proud person. You tell Dr. Prashant Bhavankule was there, and in this quiz we participated.
Yes.
He's a very dear friend of mine. So convey my regards to him as well. And best
Yes,
wishes
sir.
to you for your further thing. Okay.
Thank
So
you.
now let's move on to
Thank
team 3, Astigmatis. Team Astigmatis.
So,
Yeah. Sai, can you get this score sheet off? Yeah.
yes, sir.
Okay. So you are from Arvind Eye Hospital, Coimbatore.
Yes, sir.
Yes, sir.
Our mentor is
Yeah.
Siddharth Narendran, sir. He's actually was joined, but then I think he had a family emergency. Just messaged me, he had to go.
Okay. Tell Siddharth we missed him. Probably he
Yeah.
also missed one of the best performances from his team.
Yes, sir.
And also convey to your CMO, Dr. Narendran.
Yes, sir.
Congratulations on our behalf.
Thank you,
Madam
sir.
Anita ma'am, I think
Yes,
this
yes.
is your home team.
Yeah, I was actually excited to seeing them. They did a great job. All the best.
Thank you, ma'am.
Okay. Congratulations. So I think the in-house quiz master has not given you some clues, na, beforehand.
No,
No,
no, sir.
Just pulling. Good. Very well played.
Yes, sir.
So now the next team is going to be Team Irrational Iris. No, they are not there. Team Bifocals. Oh, that's from Basveshwar Medical College, Gulbarga. Good. Unmute yourself.
We have unmuted, sir.
Yeah, please. Just who is your mentor? We know you both.
Dr. Veeresh Porwar. He's a cornea specialist.
Okay. So how is it finding? How are you finding? Dr. Anita ma'am,
Yes,
your
yes.
subspecialty mentor.
You find mine was all cornea questions. Did you find it? How was the?
Yes, ma'am. They were interesting questions, nice questions, ma'am.
Easy or tough?
They were medium levels. They were good.
Medium levels. So you can't displease you the quiz masters right now because we are not getting the scores. Okay, well played.
Thank you.
Congratulations and keep playing well.
Thank you,
We will
thank
be letting you know the results at the conclusion of all the quarterfinal rounds.
Okay.
So let's move on to the next team, Team Brave Believers from Gandhi Medical College, Bhopal. Yes, where are you? Dr. Bhaskaran sir, just hold on with us. We'll have some chat with you as well once we are through with the teams. Thank you for being with us, sir. Thank you. Team Brave Believers. Okay. Team Champions from Government Medical College and Hospital, Aurangabad.
Yes, good evening, sir.
Good evening.
So from Maharashtra, finally, I'm so happy to see.
Thank you, sir.
So who is your mentor and who is head of the department?
Dr. Archana Vare, ma'am, sir.
So she's your mentor as well?
Yes, sir.
So ask her to log in when you play the next time. We would love to have
Yes,
mentors
sir.
with us.
She
And
has
best of
logged in
luck.
today also. She
Okay.
has logged
She's
in
around?
today also. Yes, sir.
While during quiz, she was there. Now I think she has logged out.
Okay, now share. Okay.
Yeah.
Tell her we missed her because we would have loved to chat with the mentors because of whom your students are doing so extremely well.
Yes,
Okay.
sir. Thank you.
Chalo, best of luck. So then we have team PG from Gulbarga Institute of Medical Sciences. Do we have this team? Okay. The next team is Symbiotes from Jipmer, Pondicherry.
Yeah, good
Where are
evening.
you?
We are here.
Yeah. Come on.
Yes, sir.
So just introduce yourself and your mentor as well.
So myself, Dr. Arun Sai, sir. I'm final year. And I'm Kalyan Basa. I'm second year, sir. Our mentor is Dr. Ramesh Babu, sir.
Ramesh Babu, sir. Tell him, congratulate him on our behalf. We are
sir.
proud of you. We have every year a team from Jipma. Okay. So, and they make it to most of the times to the semi-finals and finals. Wishing you all the best.
Thank you,
Don't
sir.
get pressurized. Okay. Best of luck.
Thank you, sir.
You were very
Eshnik Bus. Yes, ma'am. Please, please.
They were very shrewd and sharp, actually.
Yes, they are very sharp. The team Jipmer has always been into semi-finals and finals. One or the other people. They are doing extremely well from that institute as well as from your Arvind Coimbatore teams are very, very sharp. So now let's move on to the next. Elchnik Pearls from JSS Medical College, Mysore. Elchnik Pearls, are you there with us? Okay, I don't see them. KMCRI from KIMS Hubli. I think that is from
Good evening, sir.
Dipti, Dr. Dipti Joshi's place. Come on, which college you are?
KMCRI Hubli, sir, Karnataka.
Okay, okay. Who is your mentor?
Dr. Satish Sheth, sir.
Oh, Satish Sheth. Oh, he is a great innovator. Congratulate him on our behalf and expect him to be there for your further rounds.
Yes, sir. Yes,
Best
sir.
of
Thank you, sir.
luck. Next team is team GMC Lisa, Kottayam Medical College. Okay. Then we have team Nagri from Nagri Eye Research, Ahmedabad, Nagri Hospital. Team 15, Nagri. Okay. I think everyone has rushed for the dinner, I believe. Then Shifa Eye from PMCH Patna. Shifa Eye, yes. We can't hear you. We can't hear you. Unmute yourself, team 15, Nagri. Unmute yourself.
Sir, team 15, Nagari.
Okay.
Sir, I am a third year resident, Vishruti Trivedi. And sir, I am under Tejas ma'am, Tejas Desai, and she is my retina specialist. Sir, my teammate is in emergency, so she wouldn't be able to come.
You played all alone today?
Yeah, sir, I played alone.
Quite creditable. Best of luck.
Thank you, sir.
And tell Tejas ma'am, I remembered.
Yeah,
Okay?
yeah, thank you, sir. Yeah.
Best of luck, better.
Yeah.
Bye. Shifai from PMCH Patna. Okay. Then we have Coneheads from Sankara Hospital, Coimbatore. Coneheads.
Hi, sir. My teammate also had to leave.
Okay.
I'm Dr. Siobhan. I'm second year resident in Shankara Hospital, Coimbatore. And our mentor is Dr. Devi Priya. She's the chief medical officer and her specialty is medical retina.
Okay. Chalo, best of luck. And tell
Thanks,
Jackie
sir.
sir, we remembered
Sure.
we missed him today. Tell them you performed extremely well today. He
Thank
will
you,
be
sir.
proud of you. Best of luck.
Thank you, sir.
Okay. Then Pupil Patrol from St. John's Hospital, Bangalore. Where are you? Come on.
Good evening, sir. Good evening, sir.
Who is
I
your
am Dr.
mentor?
Reshma. Our mentor is Dr. Shubhashri. She's cornea specialist.
Oh, I see a lot of predominance of cornea surgeons as mentors today, ma'am. What's this, Anita, ma'am?
I'm also excited to know all this.
You can have a small chat with these guys.
Yeah, like they were amazing actually, high energy. Like seem to have like when just see them with like you get excited.
Thank you.
They answered well, and there was a good coordination between them to answer the questions as well. Yeah.
That's a good, kind words and a good words of means appreciation from a quiz master.
Thank you so much. Thank you so much.
Keep yourself grounded for the next rounds as well. Okay, we want you to do well as well. Okay,
Yes,
best of
thank
luck.
you. Thank you, sir.
So next team is SRM's team from Bareilly. Bareilly से SRM team.
Hello,
Unmute,
sir.
unmute. हाँ बोलिए.
This is Dr. Varun, sir. Along with me, I have Sir Dr. Anuga ma'am. She is my senior, and she has logged in from other device.
Okay.
And our mentor is Dr. Nilama Malhotra ma'am, a cornea specialist.
Oh, again one more mentor as cornea specialist, ma'am. Good, good. Tell Dr. Mehrotra ma'am, you did extremely well, and our congratulations to her as well for a good performance from your team. Again, ma'am, Anita ma'am, one more cornea specialist as a mentor
Yes,
today.
all the cornea surgeons are there with high energy, you know. Good.
Of course, I'm now feeling so. I'm feeling so, definitely. Okay, chalo, best of luck.
Thank you, sir.
And the last team is from I Foundation, Coimbatore, Icons.
Good evening, sir.
Who is your
Sir,
mentor? Your ma'am or who?
Dr. Jatinder Singh, retina specialist.
Oh, Jatinder, dear friend. Okay, okay. Not
Yes.
Shreyas, not Chitra ma'am.
No.
Tell Chitra ma'am that we missed her and her team is performing so well. Okay?
Yes, sir. Yeah, thanks.
Best of-
Thanks.
All the best.
Thank you. So we have one of the private practitioner category. One of the winner is Dr. Jayaprasad Bhaskaran, who has logged in. Sir, please come live. Get your audio visual on. Madam Anita ma'am, this gentleman is always one amongst the person who will always steal off some kitty from our brain teasers, some is an habitual winner for us. And look at his age. He's
Hello.
more attitude on most of us. Sir, few kind words.
Yeah, definitely. This quiz program is inspiring, and it also contributes to enhancing our knowledge, ophthalmic knowledge. It was really nice, and Dr. Anita, you conducted it quite well. The rapid fire is one place where all these children, I feel, they are really inspired, not only to improve their knowledge and to show their knowledge, but also to improve their confidence. That is what I see. They get the courage to stand up and talk.
Yes.
And think fast on their feet. That is one thing. I think we have met somewhere in Coimbatore, Dr. Anita. We had Dr. Rodney, the retina person, is my close friend from Kollam. I'm basically from Kollam.
Hello, sir. Okay.
Yeah,
Sir is a
hello.
very senior practitioner. He doesn't look like that, but he's seriously a very senior practitioner. And in spite of that, his zeal to participate and be competitive even at this age is a thing which we
This
all.
has been helping me in a big way, Prashant. That is why. And Shilpa, hello Shilpa. I met her during the recent conference too for the first time. Yeah, after seeing her digitally for a long time. Personally, I met, but I didn't see Prashant. Anyhow, the program is running really well. Well organized, well conducted, I should say, Prashant. It's really
Thank you, sir.
inspiring. You're
Thank you
doing a lot of good work, Shilpi.
Thank you, sir.
Congratulations.
Thank you. Thank you, sir, for kind
Yeah.
words.
Yeah.
So I think we had a good session, or means we will be having so quarterfinal 2 and today was quarterfinal 2. So we are at the conclusion of quarterfinals 2. Quarterfinal 3 would be on 7th of May at same time 7:30 p.m. So all the team, all the PGs do participate in that particular rounds as well. Even if you are not participating as a team, you can participate in the private practitioner category to learn from how the other teams perform, so that in event if you are making into semi-finals, you will be well versed, well read, well understood about the subject as well as the quizzing patterns. So with this, it's time for us to say goodbye. Before I say goodbye, once more a sincere most thank to Dr. Deepti and Dr. Anita as well as Dr. Arvind for creating such a wonderful experience for all our postgraduates and for all the efforts you took for this young brigade of postgraduates. And of course, my sincere most thanks to our sponsor, His Highness team, and the numeratic team for taking care of the whole this digital platform on behalf of us. And of course, a few kind words and a special thanks to my co-host who does all the back-end work on behalf of our team. Thank you once more, everyone. So till 7th of May, it's time for us to say bye-bye. Bye-bye. Thank you, ma'am, once more.
Thank you. Thank you. Thank you so much.